Good day, Chesson everyone. Welcome to Batan Academy, a National School Guidance TV, the official YouTube channel of our school, Batan Academy, a National School. Once again, this is Sir Jose Pradel Francisco Jr., your guidance counselor at Batan Academy, a National School. Mental health, as defined by the World Health Organization, is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Why is mental health important? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. Mental health is important to every stage of life, from childhood and adolescence through adulthood. Why is mental health important to students? There is a clear connection between mental health and academic performance. Helping students make the most of their education is everyone's goal. Students struggling with depression or mental illnesses have a harder time feeling motivated, learning, concentrating, taking tests, etc. Therefore, mental health awareness is essential to all of us. What is the importance of mental health awareness? Mental health awareness increases the chances for early intervention. This can result in a fast recovery. Awareness reduces negative adjectives that have been said to describe all people with a mental illness. By raising awareness, mental health can now be seen as an illness. These illnesses can be managed by treatment. Today, our topic regarding mental health is important. Everyone is invited to watch this video. Good luck and happy viewing.
Last year, our high school lost 3 students to suicide. Our son struggled after that, but he got treatment that worked.
My niece was 15 when she injured herself and had to stay in the hospital. They helped her find a program where she learned how to manage her feelings.
My son used to say, "I don't want to be here anymore," and "I'm such a loser I can't stand it." We got him connected with a great therapist, and he sees himself and the world differently now.
One of the girls on the volleyball team had to take a year off, and we were all worried about her. But she's better now, and a great part of our community.
Suicide is the second leading cause of death for youth in America. Families, friends, schools, and communities all play an important role in providing support for young people who are struggling. Sometimes specific help from medical and mental health care professionals is also needed to treat suicidal thoughts and behaviors. Evidence-based treatments for suicidal thoughts and behaviors can reduce suicide attempts, as well as the need for hospitalizations in young people. In an emergency, therapists and medical providers are able to work with individuals to create a safety plan or a crisis response plan. Both of these identify dangerous thoughts and behaviors, as well as coping strategies, personal support, and professional resources that reduce the chances of suicide. There are 5 kinds of therapy to be aware of for treating suicidal thoughts and behaviors. CAMS stands for the Collaborative Assessment and Management of Suicide. DBT stands for Dialectical Behavior Therapy. CTSP stands for Cognitive Therapy for Suicidal Patients. BCBT stands for Brief Cognitive Behavioral Therapy for Suicide Prevention. ABFT stands for Attachment-Based Family Therapy. Each of these is an effective treatment that reduces the chances of suicide for a young person. Therapists trained in any of these therapies collaborate with a young patient to identify personal warning signs and effective coping strategies. Each treatment has a slightly different focus, and young patients and their therapists should choose the treatment they prefer. CAMS, CTSP, and BCBT are evidence-based treatments that focus on cognitive behavioral therapy. Youth learn that thoughts, feelings, and behaviors are all related, and they learn how to adjust thoughts and behaviors in order to reduce or eliminate the patterns that lead to suicidal thoughts or attempts. DBT is also evidence-based and provides an extensive structure of therapy and support, including individual therapy, group therapy, skills practice, and sometimes medication. While intensive, people who participate in DBT often enjoy sharing their experience with other participants in the program. Practical, life-saving skills to use during crisis are an important part of this treatment. People also practice managing day-to-day activities, relationships, thoughts, and beliefs about themselves and others. ABFT is a promising treatment that includes both the youth and their parents and addresses specific relationship conflicts within a family. No matter what, if a young person is in a suicidal crisis, stay with him or her. You can always go to the nearest emergency room, call 911, or contact the National Suicide Prevention Lifeline at 1-800-273-TALK at any time. It is vital to address suicidal thoughts and behaviors among youth in crisis. Knowing some of the different treatment options is a critical first step in your ability to be part of the solution. There is always help, and there is always hope.
Thank you, learners, for watching this video. Hopefully, it raises your awareness on mental health. Our appreciation to the rightful owner of this animated video on mental health. Thank you so much for your videos in YouTube. That's all for now, and if you haven't subscribed yet to our YouTube channel, please do it now so that you will be updated with our latest videos. Once again, this is your Sir Jose Freddy L. Francisco Jr., your guidance counselor, saying thank you so much for watching this video. More videos will be coming out to help you, our dear learners. Please watch out in our YouTube channel, Batan Academy Guidance TV. Thank you so much. Stay safe, everyone. God bless us all.